Hello. So I have scenario number one, which describes a 63-year-old man who's admitted to the ED for lightheadedness and dizziness. His wife brought him to the hospital. His medical history: congestive heart failure and an acute myocardial infarction. He takes NSAIDs at home for chronic back pain. When he was admitted to the ED, his vitals were pretty normal. Blood pressure was 138 over 84, pulse was 76, his respiratory rate was 16, and he had no fever with a temperature of 98.6. His labs came back normal. He has an IV that infiltrated, so the nurse had to place a new IV. Around 21:30, however, Mr. O was on the bedpan, and it was found to have a large black tarry stool, and he was complaining of not feeling well. The nurse took a new set of vitals. His blood pressure had dropped to 94 over 66. His pulse was high, 114, and his respirations were high, 24, and his pulse ox was 97. So his oxygen was okay. He was pale and his skin was clammy. Um, Ben asked him how he was feeling. He said he didn't feel well. He said he was in a lot of pain. Ben had assessed his abdomen and found that it was distended, and he had, and Mr. O had incredible abdominal pain, rating his pain at a 6. So right now, what I'm going to do is I'm going to call the doctor with our SBAR. Hi, Dr. Khan. This is Brandon, the nurse here taking care of Mr. O. How are you today? Fantastic. No, I'm calling in regards to Mr. O, 63-year-old male. We just got, he's in here for lightheadedness and dizziness, uh, history of congestive heart failure and an MI, and he takes NSAIDs at home. So the aide had just taken him off the bedpan, and it was found to have a bloody, tarry stool. Um, he says that he's in pain. Yeah, I took vitals. Blood pressure 94 over 66, heart rate 114, respirations 24. And he rates his pain as a 6. Yep. Well, I would recommend. Well, I think that we need to definitely take him off those NSAIDs. Maybe get go to imaging, identify if there's an ulcer. Yeah, maybe start on some anti-anemics, like some Pepsid or something. Okay. And then, do you want me to order blood? Okay. And then for pain, anything I can give him for pain? Oxycontin. Oxycontin, 5 milligrams. PRN. Q4. Okay. All right. They are gone. All right. So I just got off the phone with Dr. Khan, and I just gave him my SBAR, my situation background assessment, um, and our recommendations. Excuse me, sorry. So now I'm going to debrief, start my debrief. What are my thoughts on the clinical scenario? Well, my first thought is having to get labs. It's interesting to me that he came and we had initial labs done, and now that he's presenting with this tarry black stool, um, is concerning. But it also goes hand in hand with chronic use of NSAIDs, as people are more prone for gastric ulcers and things like that. Second question: what do you think could have been added to the SBAR? Well, things that could have been added to the SBAR. I don't think anything could have been. I have his age, I have his sex, medical history, I have vitals. We did an abdominal assessment. He was distended. He had a bloody tarry stool. I called the doctor to see if we can get a lab for maybe an occult test, which is where they test like the fecal and for blood and things like that. What do I think that was not needed? I think all the information provided within the scenario was necessary. It was good that we know that he took NSAIDs because that's like a key indicator as to what's causing this black tarry stool. Um, it's good to see his baseline from when he came. So the vitals that the initial nurse Jenny took, where his vitals were good, 138 over 84, 76 was the pulse, respiratory rate is 16, and temperature was 98.6. I think those are good things to know. Maybe, taking out the fact that his IV infiltrated, I don't think that was needed. But I mean, it's good to know that he has a line running. And then all the things that Ben, the RN, did as far as doing his assessment, taking vitals again, I think that's all pretty much relative. If we did this conversation again, what would we do differently? What should we do differently? Well, I don't know. I think I handled the scenario well. Essentially, just relaying the information to the doctor and then getting orders. I got an order for Pepsid, and I have an order for OxyContin PRN. And the Pepsid, we're gonna give it 4 times a day, and it's a 10 milligram dose. Do you think the significance of the situation was clearly presented to the physician? I think so. I think it was clearly presented just because I told him the important information. He came in, he was normal. Now he's not. His blood pressure is tanked. He has this black tarry stool, and he takes NSAIDs at home. So those are some indicators to help the doctor figure out. Oh, okay. Well, he might have an ulcer, and that's what's causing his bleeding. So yeah. So that's what I think. I think the significance of the situation was clearly presented to the physician. And that is it.